Hello, welcome to ADHD House Podcast. I'm your friend Blue. As usual, I will share a story with you first. This story comes from a real case. Her name is Summer. She was diagnosed at 25 in March 2018 with ADHD. She was told she was brilliant in her life, but also lazy and stupid. She almost failed out of college. She watched as people passed her and felt she wasn't living up to her potential. She felt that something was wrong, but she didn't know how to improve these things. She lost her first professional job after college and fell into a suicidal depression. She couldn't organize a job switch. Summer said the hardest thing is dealing with what she feels is her past, and knowing that her future would not be what she wanted it to be. The other thing is that her friends and families don't even really believe her, and don't pay more attention to it as a part of her life. They apologize for being so hard and critical in the past. Most of them have not mentioned it since Summer first told them. People are used to criticizing her that they don't like the fact that there's no reason for her inability to live life like the rest of the world. Everyone has just switched to saying that she is making excuses. She has been late for everything since the age of 10. She thinks the only reason she was on time prior to that was because her organized mom ran her life until grade 5. Summer lost track of time easily and have no concept of how long things take. Now she is receiving treatment from a doctor, and it was like wearing glasses for the first time. She gets her dream job and is doing much better now. She never consulted ADHD before because she had a misconception of what the disorder was. Now she knows it's all them not paying attention and being happy. She honestly hopes that she will find someone to love someday who will help her with small things so she can realize her dreams. Until then, she is trying to get into a better life. Here Bill wants to tell ADHD patient a few words. Don't be disappointed by ADHD. If life is full of hope, you will feel happy and peaceful. I also have some tips for ADHD patients. Firstly, create a space. Ask yourself what you need on a daily basis and find storage bins for things you don't. Pick a place for things like keys, bills, and other items that can be easily misplaced. Throw away things you don't need. Secondly, learn to say no. A jam-packed schedule can leave you feeling overtired and affect the quality of your work. Taking things down may improve your ability to keep social dates and live a better lifestyle. Check your schedule first before committing to something new. Lastly, get enough sleep. Okay, let's go to the next part. Today I also invite a friend here. Her name is Olivia.
Hello, Bill. Hello, everyone.
Hi Olivia, this is a very exciting day. Are you ready to share your ADHD story with us today?
Yeah, sure. I'm very honored to share my experience and hope that my experience will help those ADHD families.
Olivia, could you introduce yourself first?
Well, my name is Olivia Hu. I am an ADHD patient and I'm also a student in University of Sydney. And now I'm trying to help more ADHD patients in Sydney.
At what age were you diagnosed with ADHD? Did you realize that you had ADHD before your official diagnosis?
I remember that I was 18 years old while diagnosed with ADHD, and while I had always known that something wasn't quite right, and I never realized that the cause was ADHD. And after the detailed diagnosis, my doctor told me that I have ADHD.
Yeah, it's very hard to realize if you have ADHD by yourself. Okay, let's move on to the next question. What's the symptom of the ADHD in your personal experience?
Well, like many people with ADHD, I was not very good at group work, and some self-focused behaviors always happened to me, such as interrupting others, and I kept interrupting our group work last year, so the final result wasn't very satisfactory. At the same time, my friends refused to communicate with me because of the disease. I think this is my worst symptom of ADHD in my life.
You're very open about disclosing your ADHD. What sort of response do you usually get from others when you tell them that you have this disorder?
ADHD is a personal matter, and the decision to disclose is an individual one. Personally, I choose to talk about my ADHD because I feel it's a part of who I am. As to the reactions of others, I think that they fall into two groups. One group is very interested in my experience, and another group is very skeptical about me.
Do you regret telling people that you have ADHD?
No, so as I said before, this is already part of me, and I'm very happy to share my excitement that I am feeling as I gain more control of my life.
Does ADHD bring you unexpected gains?
Of course, ADHD brings me creativity, and I do sound highly creative in my approach to problem solving. Having said that, I still work the hardest at mitigating the impact of ADHD on others around me.
Does treating ADHD usually require medication assistance?
I don't think that medication is right for everyone, because some populations have been over-medicated today.
Yeah, you're right. Can you explain how medication helps with your symptoms?
So, after I was diagnosed with ADHD, I started to take the first capsule. I could get things done immediately, and that made me more productive and reduced my daily stress. Although the medication wasn't very perfect, but it overall improved the quality of my life.
Do you have any advice for the parent who has just found out that their children has been diagnosed with ADHD?
Well, parents should understand that the ADHD does not need to limit their children's performance, and don't let the negative remarks deter to advocate for his educational needs. After all, kids with ADHD can succeed if they get the help that they needed.
How about for the adult who is newly diagnosed?
Well, for adults, I think the combination of the medication and the behavior therapy often works very well.
Is there anything else you want to share with our listeners?
Yeah, so I hope that every patient with ADHD can get the help and advice earlier and as soon as possible, so they can control their life more.
Thank you, Olivia, for sharing so much of yourself with us here today. If you are a member of ADHD families who has adult ADHD, we wish to encourage you to share your story. Sharing your story helps others who are facing the same challenges to know that they are not alone. Thank you for listening ADHD House today.